awesome Tuesday speaker, Dr. John Bergman.
Now, tonight we're talking about home remedies. The tough part with this is it's going to kind of put responsibility on you. How many people utilize medical care? I know what's tough is because when I say medical care, they're not really into health care. One of my patients, she's a pharmacist, and there was a conference going on, and I said, "Why are you going to this conference?" She said, "No, that's for healthcare." And I said, "Well, you're a pharmacist, aren't you into healthcare?" She said, "No, we're in disease management." You're in disease management? Okay, yeah, we're in disease management. So when you look at this, one of the greatest speakers I ever saw, his name was Dr. Fred Barge. He would quote himself. So in his honor, anything that helps the immune system is good. Anything that weakens it is generally bad. That's Dr. John R. Bergman. I know, I just wanted to quote me. Okay, now what's tough is, if you look at this, we're going to talk about home remedies, but what are the main things? Infection and illness. Okay, so if you can solve both of them, it's ideal. But the entire medical community is a juggernaut, and it's moving in the wrong direction. It thinks that the disease is the thing that we're going after. It's supposed to fight cancer, fight the war on diabetes, the war on this. That's all a lie. It's the wrong direction. Now, pathogens, they're either virus, fungus, bacteria, or mold. These viruses, fungus, bacteria, or mold are everywhere. They're everywhere. They're not a problem unless you have a weakened immune system. Now, Dr. Theobald Smith came up with this formula, and I like formulas. This one works out really well. It's called the severity of disease. Now, severity of disease has a couple of different factors. One of them, the number of pathogens. This means the amount of bacteria, the amount of virus, the amount of fungus, mold, whatever. How strong it is. Like, is it Ebola or staph? Okay? Also, the opening size. Now, all of this is divided over the resistance of host. Now, this is huge because disease can kill some of the pathogens, it can weaken some of the pathogens, and they can close up the opening. But there's nothing in medicine today that strengthens the resistance of host. Nothing. What medication strengthens your immune system? Anybody? None. None. So the entire juggernaut that we call disease management, because I'm not going to call it healthcare anymore because it's not, that entire juggernaut is not designed for health. So we got to change that. So first off, if you ask most doctors, they're going to go in there and they're going to say, what's the cause of stomach ulcers? They're going to say, well, we know that now, it's bacteria, it's Helicobacter pylori. And this is, now you got to figure, for about 30, 40 years, we've known that stomach ulcers just kind of appear. And then one Australian guy comes in there and says there's a bacteria in there. Okay, and most doctors disagreed. They said it was too acidic an environment until he found it. And then we start finding out, oh, this is the cause of all ulcers. And it's not true. It's wrong. Turns out that this is a normal bacteria in about half of the world's population. So if this is normal in half the world's population, how could it possibly cause disease? Do you want to know? Come on, this is really good stuff. Okay, good. I'm so glad. Well, I'm going to tell you. No. The reason it's normal in most of the world's population, because they have healthy stomachs, they have healthy tissue. See, this, like all the other pathogens, all the other viruses, funguses, and molds that are supposed to be responsible for disease aren't. They're only opportunistic. If you compromise blood supply or nerve supply to the stomach, or you weaken the stomach tissue in some way, then this bacteria will attack it. So it's not that Helicobacter pylori causes stomach ulcers, it's the weakened tissue. It's the weakened tissue. And you're going to see this repeated over and over again. This one here, now when you look at this is a type, Moxarella catarrhalis. Now this one here, it's responsible for pneumonia, bronchitis, meningitis, that's inflammation around the brain, endocarditis, sinusitis. So you might say, wow, this is responsible for all these diseases. If you were in that mindset that disease comes from virus, fungus, and bacteria, but it's not. Then you also look at this and say, wow, this is normal in about half the world's kids. So wait a second. If it's normal in half the world's kids, Okay, but it also causes pneumonia and bronchitis. Why does it cause pneumonia and bronchitis? Can you guess the answer? Weakened immune system. Oh my gosh, so do you see a pattern here? Does Helicobacter pylori cause infections in the stomach or ulcers, or is it the weakened immune system? Weakened immune system. So does this thing cause bronchitis and pneumonia and endocarditis No, it's the weakened immune system. So any therapy that we do that weakens the immune system causes these infections. Okay, now I know I'm going like way too slow, but I want you to own this. If you own this, you're going to find out that what we have to do, what we consider healthcare isn't really healthcare. It's disease management, and all it is distribution of medications that are ineffective. This one, E. coli. Thank God I got E. coli. And my E. coli is located in my intestinal tract. It's helping breaking down some nutrients. Right now, I'm actually producing vitamin K using my E. coli. Pretty cool, huh? Of course, if E. coli was in my lungs, it wouldn't be good. So E. coli in one area is really good, in another area it's not good. So then you got to look at it, and you think this is responsible for most of the hospital-acquired infections. Hospital is one of the most dangerous places around. And it can do all these different diseases, but again, it's not the bug, it's the weakened immune system. We all have this bug. Okay, it's supposed to be there, it protects you. Then when you look at this one, tetanus. Now, this is the most frustrating, absolute, wrong, antiquated. Is the world flat or round? Okay, anybody that suggests a tetanus shot is a flat earth thinker. They don't know the world's round. They're thinking that you sail so far you're going to hit sea monsters. One of my patients, he's washing dishes, okay? He cuts himself with a broken glass in soapy water. He goes to the emergency room, and the emergency doctor says, well, when was your last tetanus shot? Okay, now, this isn't really funny unless you know about tetanus, okay? See, tetanus has to come from a sick animal. So a cow has to poop on the ground or pee on the ground, and then if the stick or sharp object that it pees on is exposed to air, the tetanus dies. So now, he's washing in soapy water. Air kills tetanus quickly. Water and soap kill it quickly. Do you think he's at risk at all of getting tetanus? No. Was a cow walking by while you were washing dishes and urinated in the soapy water? No. I was in my kitchen. Okay, good. So you don't need this. So he goes in, and while I'm on the phone with them, he says, I got my chiropractor on here. The emergency room doctor's walking by. And my chiropractor says I'm not at risk for it. And the emergency room doctor says, you're right, you're not at risk for it. We just give it out. That's our standard protocol. Gee, I'm sure that makes sense somewhere. No, that's just stupid. And then you look at this, when you look at the history that we're gonna explore this vaccine next week, you're going to be so upset that they inject this in kids, because not only have they had to weaken it like 5 different times because it's caused thousands of deaths and injuries, the vaccine itself, this thing is linked to rheumatoid arthritis, MS, lupus, and what you're looking at, if you look at the diseases it's linked to autoimmune disorders. This means you get these foreign proteins injected into your bloodstream and your body attacks itself. Okay, we're talking with no benefit. And what's even more frustrating, wait a second, now this thing dies in the presence of oxygen. God, if there was only a material out there that you could pour on a wound that would flood it with oxygen instantly. What if we bound it to some like hydrogen? Now, let me see, what kind of material out there would have hydrogen with 2 oxygens attached to it that if you pour... Oh, hydrogen peroxide! Oh my God, it's been around for about 200 years. You pour this on a tetanus wound, it instantly kills it, and you can actually drink it. It's fantastic. Now, is this a nice home remedy? Yeah. Well, you're going to find out this has been used in India and in Europe, in America, forever for solving infections. It's phenomenal. But this thing kills tetanus. That's nice. Antibiotics. Now, this can absolutely save your life if you have a positive bacterial infection, a positive culture for that, and they prescribe the right antibiotic for it. Absolutely essential. Okay. Now the problem is, Alexander Fleming, at his Nobel Prize speech, when he won the Nobel Prize for discovering that poisonous mold will kill bacteria, he said, be very, very careful that bacteria are going to get resistant. And sure enough, 1946, it killed about 80% of the staph infections. And then you're talking just a few years later, in 1950, it killed about 61%. So we're seeing staph-resistant organisms, okay, about 60 years ago. Then you're talking about now, it's less than 5%. That means 95% of staph infections are not injured by penicillin. So this means it gets stronger and stronger and stronger. Okay, is this dangerous? Hugely dangerous. Okay, this is one of the things that's killing more people than AIDS. But then you get this disease management juggernaut that keeps going along. Have you ever heard of an ear infection? Okay, now, did you know that ear infections aren't really infections, they're effusions? Have you heard that yet? Go on. Who wants to say what's an effusion?
What's an infusion?
Oh my God, I'm so glad you asked. Okay, well what happens is, do me a favor, and this is how I explain it. Swallow. Do you hear crackling in your ears? Well, try it again really loud. You hear it? What you just did, you flexed the soft palate. And that opened up two tubes that drain the middle ear. Now those tubes are called eustachian tubes. Now what happens is, if the back of the throat swells up, the tubes can't drain. The tubes can't drain, they fill up with fluid. So what is the cause of most ear effusions? It's lack of function of the soft palate, or it's swelling of the soft palate. Now what's frustrating with this is, in chiropractic, this is what I do. I understand the soft palate is controlled by the upper cervical ganglion. You adjust that, 86% of the time, ear infections are cured in the first visit. I'm sorry, 86% of the time, first visit. I know, that's what I was thinking. And it's drugless health, it's almost like listening to the body. British Medical Journal goes in there and sees this red swelling inflamed because the kid hurts, his ear hurts. And you go in there and you look with this little otoscope and you can see this red bulging membrane. And for 40 years they made mistakes. For 40 years they said, wow, it's red, bulging, inflamed, it must be infected. No! They finally go in there, they draw the fluid out, they put it in a petri dish, and they find out 93% of the time the fluid that they draw out of the ears is sterile. It's sterile. That means there's no bacteria. That means for 40 years we gave these kids antibiotics for absolutely no reason, with absolutely no science. So what does this giant juggernaut of stupid disease management still do today? They still pass out antibiotics, okay, which is incredibly dangerous. Now this is out of the Clinical Infectious Disease Journal, and this was just about 5 years ago. They said, stop it. We're going to correct this 40-year-old mistake. Stop passing out antibiotics for ear infections. So if you have a pediatrician or medical doctor that's passing out an antibiotic for ear infections, he's doing something that's not appropriate. He's given a poisonous mold that will increase your risk of cancer, so he needs to be fired. Or read this. Now this is important. If you've had 10 courses of antibiotics and you're a child, your risk of non-Hodgkin's lymphoma, this is a cancer, is increased, okay, 80%. So those benign, are they benign to give antibiotics for ear infections, or do they lead to cancer? Okay, what was that quote by that brilliant doctor at the start, the brilliant modest guy? Anything you do that weakens the immune system is bad. Anything you do that strengthens the immune system is good, okay? Do antibiotics weaken or strengthen the immune system? They weaken it. They do, 100 times out of 100. If it's life-threatening, by God, it'll keep you alive. If it's like this, that's absolutely foolish. This one. Antibiotics, okay, cause allergies. This means you weaken the normal flora. What they did out of this study, and this was out of Lancet, it was brilliant. They actually gave living bacteria to pregnant women. It's called a probiotic. Antibiotic means against life. Guess what probiotic means? For life. Yeah, baby. Okay, so these are little pills with billions of little bit of bacteria in there. Now what's nice about this is you replace that bacteria, it replaces the normal flora, and it's actually beneficial. They gave it to pregnant women who their children were at risk of developing huge allergies, and turns out the kids developed healthy. It turns out that bacteria are good for you if it's in healthy and the right form. Then they even gave it while they were breastfeeding, and the kids got more healthy bacteria. Then they even put probiotics in when kids graduated to the bottles, and they found out that they had almost virtually no allergies. Wow, doesn't that make sense? So we're using healthy bacteria. So anything you do that strengthens the immune system is good, anything that weakens it's bad. Lung infections. Now this is huge. Lung infections is one of the most dangerous things around. And in fact, today, pneumonia is still called the old man's friend. The percentage of people that die with pneumonia today is the exact same percentage that died in 1900. So 100 years has gone by, we haven't changed the death rate. They live about 2 weeks longer. Okay, now I wouldn't call that a really good quality of life, but the same percentage that gets it, the same percentage that dies. So we need to do something different. Now, first off, the lung infection is going to be a virus, fungus, or bacteria, or mold. Okay, all viruses, funguses, bacteria, and mold die at a higher temperature. So the first thing, heat up the lungs. Okay, so humidifier, fantastic. And then you start looking at this, hot steam bath, warm liquids. When you swallow, you've got a food tube that goes right down behind the air tube. This is why hot liquids are so essential. You heat up that food tube called the esophagus, you're going to heat up the trachea, and that's the air tube. And the viruses, funguses, and bacteria die at a higher temperature, so it's fantastic. So hot liquids, that's why on the sheet here, you're talking about a natural home remedy called a heat-generating liquid at first sign of emergency. Now think of this. A lemon, okay, so we're talking it's going to alkalize your system and load it with vitamin C. A ginger, okay, again, heat-generating herb, you're actually going to increase your body temperature. Cayenne pepper, that's a vasodilator with soluble fiber that's going to actually open up the blood vessels and clean the arteries. Peppermint, phenomenal. Or oregano, both of those are antimicrobial. You heat this up, boil it up, drink it down as fast as you can, don't burn your throat, but that's going to generate heat. Viruses and bacteria die at a higher temperature. Phenomenal. Licorice. And I'm not talking the little red stuff that you give out to kids to, high fructose corn syrup. I mean the actual honest-to-goodness root. This is, it elevates the blood pressure. If you have a lung infection, you've got areas inside of the lung that need higher pressure in order to get that oxygen behind it. So this will elevate the blood pressure to it. Licorice, fantastic. Garlic. In World War I, pre-antibiotic, they found out that mashing up, making a paste out of garlic, would kill viruses, funguses, and bacteria. The Roman soldiers would riot if they didn't get their daily use of garlic, okay? Because it would kill E. coli. I know, think of this. Before refrigeration, they would use garlic to wipe out E. coli infections. Spices, we're talking ginger, powder. I mean, all of these things are incredible for lung infections. Does that make sense? Okay, but now we got to look at more stuff. Homemade nebulizer. Now, you don't want to actually use nasal spray. I just use this thing as an example because if you can aerate it, you can get fluid into the lungs. One of the best things, H2O2. Now this, it's called hydrogen peroxide. You've seen it before.
What percent is that?
The 3%. Okay, you want to distill this down to make sure it's food grade down to 3 to 5% to get it in your lungs. Now, if you have one of these things, dump out all the garbage in it because you don't want any histamines in there. Histamines weaken the immune system. Rinse it out, get it clean. But what's nice about these nose sprays, it has a very, very fine mist. You don't want to shoot it in your nose. You want to breathe it in. So like that. This one here, I'm not sure how fine of a mist this is, but again, you want to get it as deep in your lungs as possible, the hydrogen peroxide. What's interesting with this, I was looking at studies that they actually use this for emphysema. Have you ever seen emphysema? No, I mean seen it. No. You have, but you haven't recognized it. Okay, I'm going to show you how to recognize emphysema from like a block away. Your lungs want to collapse. Your ribs want to pop out. And emphysema means you have long-term damage from the lungs. In normal breathing, your ribs go in and out. In emphysema, you have a barrel chest. So you'll see people walking around like this. They generally have a little oxygen bottle behind them. Okay, and they're smoking. Okay. You've seen them. Okay, now you have seen. Okay, I know you've seen these guys. Okay, well, they got to breathe like this, where they're moving up and down, where they're trying to get that oxygen. They're actually using their organs to exhale and inhale. Now, what's interesting with this, remember, hydrogen peroxide, if you pour it on something, it releases that oxygen. Okay, it's a very unstable molecule. So you release that oxygen in a virus, fungus, bacteria, and mold, which is loaded. I mean, it's just killing these people with emphysema. They breathe it in, it foams up inside of their lungs. So they cough violently. What's beautiful about that is they cough violently, they expel some of this garbage inside of their lungs, it frees up more of their lung tissue so they can transfer oxygen. Isn't that brilliant? It is. It makes so much sense.
Can you spray that in the nose?
You don't want to. Spraying it in the nose would be too harsh. If you do have a cold, you can put it on like a little Q-tip and you can wipe the inside, but it's gonna foam up and everything else. Because if you spray this in the nose, you actually have 6 sinuses, 3 on either side. They're behind the eye, they're over the head. If this stuff gets in the sinuses and it starts to foam up, that could give you a headache from hell. Because think of it, you get hydrogen peroxide in there, it's bubbling up, you don't want that stuff bubbling up inside of a sinus. Okay, you wouldn't die, but you'd want to. So now here, this is an actual nebulizer. This is something that you can pour medication in, which I don't recommend, or natural healthcare stuff, which I do. And this is expensive. This is an actual atomizer, okay, where again, you could put stuff in there, you could breathe it in, and it's still, again, you're just trying to get this into a fine mist so you can get it into your lungs. This would be my choice, okay? I like a real fine mist. I'm kind of cheap, okay? But anything, and you could cut it down to 3 to 5%. You can mix it with a little bit of distilled water, but make sure it's clean, make sure there's been no chemicals in it. But again, I mean, there's a lot of things you can vaporize. Colloidal silver. Remember just a couple minutes ago when we were talking about antibiotics? See, antibiotics is a poisonous mold that can kill bacteria. Now, bacteria have a cell wall around it where they can get more and more and more resistant to it. So they can resist antibiotics. They can't resist hydrogen peroxide. It destroys it. It's an unstable molecule that creates a free radical that kills it. There's no resistance to it. They can't build up resistance. Colloidal silver, same thing. It attacks the cell wall. There's no resistance to it. You can't fight it. Now, these things have been around for a couple hundred years. Essential oils, eucalyptus. When my kids get infections, okay, we go to the park. The parks around our area, they're loaded with eucalyptus trees. So we pick up a handful of leaves, a handful of seeds, we go in there, rinse them off, put them in a pot of boiling water, boil it, then put a towel over the pot, and you breathe it in, then you get fresh air. Then you breathe it in, then you get fresh air. Okay, eucalyptus oil. Why do we go to the parks? Because I'm too cheap to go by the home, the mother's market. I just like it. Skin infections. Okay, so lung infections, get good stuff in there. Anything that strengthens it's vital. Skin infections. Understand, skin will not have a problem unless you have inappropriate fats, which means inappropriate digestion, or you're taking in poisonous stuff. Because human beings are one of the few animals that have a layer of fat underneath the skin. So this is huge. If you have healthy blood supply, healthy nerve supply, and healthy fats, you're never going to have a problem with skin. Okay, does that make sense? But now this, a great one, if you do have an infection, like let's say you tear it on something, honey and cinnamon, phenomenal antimicrobial properties. Hydrogen peroxide, again, it kills and you could pour this topically, internally, phenomenal. Garlic, fantastic paste. You can put it on top or internal. And it's got to be fresh garlic. Aloe. There's over 7 different antimicrobials inside of aloe itself. And this is why Robin has the aloe plants back there. We're talking coconut oils. Phenomenal. Antiviral, antifungal, antimicrobial. And these are, what's wild is, I cook with 3 of these. Okay, papayas, phenomenal. You can put papayas on and it has antifungal, antiparasitic properties. If your dog has ringworm, or your kids do, rub a little papaya on it. If you're making a smoothie, use the seeds in a papaya. It has anti-parasitic properties. I mean, there's just magical stuff out there. What I want you to understand is there's cures, like this one, phenomenal book called The 1 Minute Cure regarding hydrogen peroxide. And you'll see how they use an IV hydrogen peroxide to kill cancers. They'll use small doses of it. But what's more important, is your body familiar with hydrogen peroxide?
Yes.
Yeah, but you want to know why?
Why?
Well, you probably do already. Okay, you're not a fair person. Okay. Well, your body has cancer-fighting cells called NK. They're called natural killer cells. Now, these little warriors, they're kind of like, Sicilians. They go in there and they kill tumors. 2 in the chest, 1 in the head. Well, what they use for their bullets is hydrogen peroxide. They're actually natural killer cells, NKs, that secrete hydrogen peroxide in tumors that kills them. It's phenomenal. I know. What a design. Okay. And then this one here, hydrogen peroxide, aloe, and a number of different remedies. It's fantastic. See, you're going to have to do research if you're going to be on this planet, because the medical world isn't going to help you there. Burns. Not George, okay? Or Mr. Burns. Yeah, Mr. Burns. Okay, burns. You got to clean it, cool it, cover it, and heal it. That's all you got to do. The 3 stages of burns: first it's red, second it's blistering, third you're actually seeing some meat. Okay, once you start to see some meat, that's dangerous. The best treatments that we've seen so far is they're actually soaking bandages. Okay, and this is if you're actually going through all the layers of skin. They're soaking it in colloidal silver. They're finding out that it inhibits bacteria growth and promotes healing. But these, all the different things you can clean it with, again, colloidal silver, aloe, coconut water, oil. I mean, it seems almost too simple that these ingredients would be so antimicrobial, antiviral, but they do, they work. Now, when you look at this, good disinfectant and bad disinfectants.
What is colloidal silver?
Colloidal silver, I'm going to describe how to make it in seconds.
Oh,
I know, I'm excited too. Now, what we did was a couple of weeks ago, we actually made it, and it's very, very simple to make. It really, really is. But when you look at this, good and bad disinfectants. The bad ones are anything that burns. If it burns on your skin, it means it's closing off blood vessels. So this means alcohol and astringents, bad. Never use them. They're garbage. Throw them away. The really dangerous ones are the ones that are going to be recommended by the pharmacist. These are the polysporin, the neosporin, any sporon. Okay, they're a topical antibiotic, which means that they're going to wipe out some bacteria, strengthen others, and kill the good beneficial stuff so aggressive viruses, bacteria, funguses can take over. Throw them away. Don't use them. If they're in your cupboard, get rid of them. The good disinfectants, colloidal silver. And this is actually one of the methods on how to make it. It's very, very simple. You need distilled water. You need 4 9-volt batteries, or 36 volts of power, and you send it through there. And when you're making it, it's not only can you make gallons and gallons and gallons of this stuff for just about $30 or $40, but it lasts as long as you keep it in a colored container for months. It's phenomenal. And they've been using it. They use this stuff on the space shuttle to clean water. They use it and bacteria can't adapt to it. Another good one is aloe, hydrogen peroxide. Heat is also a good disinfectant because viruses, funguses, and bacteria die at a higher temperature. And sunlight, direct sunlight, has UVB radiation, which is actually antimicrobial as well. I mean, it's incredible. So colloidal silver, disinfectant, the Food and Drug Administration actually accept it as wounds. You can soak it in wound dressing and it limits viruses and bacteria. This is how to make it. I told you. Okay, this is how you make it. Okay, you start off with distilled water, because if you have any minerals in the water, like tap water or anything, the colloidal silver will bind to it, and that's bad. So you want it distilled water, 36 volts. It has to be pure silver. It has to be 99.9% pure silver. And then you pass electricity through it. A good way to check it is to have a laser. If you're incredibly cool, you'll have a TDS meter. That's a total dissolved solvent meter. This costs around $40, and I'm pretty much too cheap for that, so I use a laser. Okay, and just guess. But if you're really, really cool, you'll have your own TS meter. Okay, then you need an amber bottle for storing. You need to let it sit for a couple hours after you do it. And you'll see it's very, very simple, but you've got to do research. You've got to do research on how to make this, because health is absolutely up to you. You cannot trust the disease management professionals that are supposed to be in charge of the health to actually give you advice on this. Now, when you look at this, hydrogen peroxide, Incredible. Now, it's a very unstable molecule, and the brilliance of it being unstable is it wants to give up that oxygen molecule, which is why it kills so many infections. The problem is most of the hydrogen peroxide that you get is not this. This says food grade. This is one of the few stores around that you can actually get food grade. See, the other stuff, the stuff in the brown bottle that you can get from the drug guys, the CVS stores, or whatever they call them now, the absolute poison stores, to stabilize that, they use toxic ingredients, which is supposed to be okay if you pour it on a wound, but I still wouldn't trust it. Use food grade for everything, okay, because anything you put on your skin is going to get in your bloodstream. They say you can use the non-food grade run to rinse your mouth. No, let's use healthy stuff. Because actually, anything you put in your body that strengthens your immune system is good. Anything you put in your body that weakens the immune system is bad. I know, it makes so much sense. Okay, and this here, 3% is fantastic. It's got to be diluted because you're going to find out some food grades are too powerful. This one's 3%, that one's 7%. You want to keep it between 3 to 5% so it doesn't burn. Now, coconuts. This is probably God's gift to mankind. It takes 9 months to fill a coconut. The water inside of it, the coconut water, has about the same electrolytes as your blood. It's totally pure. In World War II, they would use coconut IVs if you're bleeding out to keep you alive. Now, what's wild, when you look at this, it kills viruses, kills bacteria, kills funguses. And wait a second, God, that sounds similar. Can you see the same pattern here? What does hydrogen peroxide do? Kill viruses, funguses, and bacteria. So it's antimicrobial. What does garlic do? Kill viruses, funguses, bacteria. What does coconut do? Kills viruses, funguses, bacteria. Why don't we use it? Why do we use just poisonous, cancer-causing materials that are only good against a bacteria that have no effect on a virus? Why? Because the training of this juggernaut, stupid care that we call disease management, we're not going to call them healthcare anymore because they're not. They shouldn't be. That's inappropriate. Okay, we need to start being in charge of our life. So what's that going to require you to do? It's going to require you to educate yourself. Okay, it really will. And this, fantastic. Aloe. Now this, again, what's neat about aloe is it has 6 natural antiseptics which kills mold, bacteria, funguses, and viruses. Wait a second, I think I said that before. Am I talking about aloe or am I talking about coconut? Can you see the same thing? God built this planet with a wondrous variety of stuff that actually strengthens your immune system. This is growing in our backyard now, okay? Poisoning. If you we're looking for home remedies. If you go in with poisoning to Hoag or UCLA or anything else, the best anti-poisoning device that they have, guess what it is? Charcoal. I know. It's like ridiculous. When we're talking about survival, we're talking about making your own charcoal, using hardwood, making sure it's not poisonous or stuff. But this stuff binds into it. It's like a poisonous magnet. Phenomenal stuff. Now, when we talk about pain relievers, number one thing, do not use them. Don't use a pain reliever unless you know what the problem is. Okay, does that make sense? Now, when you look at this is a normal curve in the neck. This is a reverse curve in the neck. Now, she actually didn't have any neck problems. She had high blood pressure, she had a low thyroid issue, she had digestion problems, and she had some headaches. But she had no neck symptoms. So she was taking about 6 different medications. Now, if you're taking 6 medications, are you feeling good or bad? Horrible. So we fixed her neck. All the symptoms went away. If you got pain, find the source of it. And if you're healing, get it. When I was run over by a car, I was first in line for morphine. I really wanted it. And it felt great. I could have gone dancing on some broken legs. I love it. So I'm not opposed to drugs. They're okay when you need them. I'm just opposed to stupid. Okay, does that make sense? Okay, good. So when we look at this, aspirin and Tylenol suppresses the body's ability to produce antibodies. So that means it weakens the immune system. This means aspirin and Tylenol weaken the immune system. This means aspirin and Tylenol weaken the immune system. What idiot would put this in Dayquil or NyQuil? Wait, what was that government agency that's supposed to protect our food and drug supply?
Product deception.
Fraud and Deception Association. Oh, good. That's what the FDA stands for. Okay. Again, that huge juggernaut of stuff. Okay, if they read their own medical journal, we realize that we don't use this stuff in humans. Non-steroidal anti-inflammatories. This is Advil, ibuprofen, Aleve, all of the crazy stuff. It decreases cartilage production. So now let's say you got joint pain. And I'm in the disease management world. Here, take this Advil. It's going to destroy your cartilage, but you're going to actually be comfortable while your body disintegrates. Okay? No! That's dumb. What we're doing in the real world is we're going to educate ourselves on natural anti-inflammatories that actually strengthen your immune system, not something that decreases cartilage. If any doctor passes this out to anybody on the planet with joint pain, what do? Fire him. Okay? They obviously don't understand human beings. They should go back and relearn. Natural pain relievers. Water. One of the best natural pain relievers out there. Okay, if you drink water, it's going to hydrate your discs. It's going to help with thinning of the blood. Breathing. Do me a favor right now. Sit up nice and straight. Okay, take a deep breath in. Blow it out. Whoa, did you see that? I saw the carbon dioxide come out of you. It was totally cool. Okay, so you just alkalinized your system. That means your body got less acidic. That means your immune system can actually start regenerating cells. Breathing. There's multiple books on breathing, just disease away. Omega-3s, fish oils, phenomenal for tissue repair. When you look at these, cayenne pepper cream, you can actually put cayenne and a little bit of coconut oil, put it on a joint. Make sure you don't have a cut there. That'll burn like the Dickens, okay? But it actually will vasodilate. It'll rush blood to the area. Phenomenal pain-relieving cream. If you get ginger, again, brolamine. This is found in fresh pineapple. And by the way, pineapple grows really well in Huntington Beach. Anybody know that? Yeah, I've got 4 pineapple plants at home. It's really fun. It's just fun. Okay, but pineapple, phenomenal. Phenomenal. It's better to get fresh. In Germany, chamomile tea. Chamomile. It's called the cure of all cures. It not only has a calming effect, but it'll shrink swelling, shrink tissue. I mean, there's so many natural health remedies, it's almost impossible to put them in one health talk. What I want to do is just inspire you that not only are the remedies out there, but to appreciate what your body does to go through these symptoms. When you look at this, I mean, this right here, his diet is devoid of natural enzymes. His body has been polluted with 74 vaccinations. And we're going to talk about vaccines next week. Has anyone ever heard of the controversy whether vaccines cause autism or... There's no controversy. Okay, we've got pro-vaccine doctors, and then we have pro-science doctors. You're going to find out which ones are actually following more scientific advice. But this right here, that is not health. That's not. When you look at our sheet here, we're going to talk about the symptoms, what your body is doing to produce those symptoms, and how to get healthy. Does that make more sense? It does. That's what home remedies are supposed to be like. This gal here, fibromyalgia. She had muscle aches, joint pain, couldn't sleep. She was depressed and sad. And in this juggernaut of disease management, she was taking 9 different prescriptions. If you take a muscle relaxant, a pain reliever, an anti-inflammatory, each one of those slows or stops a metabolic process. So then what do they say in this juggernaut of disease management? They say, man, we can't fix you with drugs. It must be incurable. We're going to label you fibromyalgia. Okay, I'm sorry about that, but you're going to die with this. There's no cure. She comes in, we get her drug-free within 30 days. Within 90 days, she's cured of the disease. How many times does this happen? 100%. How many times? 100%. Why? Because she's human just like you and me. Okay? Her body deserves to be healthy. It's just screaming. It's telling us all the symptoms there. That's ridiculous. That's ridiculous. You don't drug people to health. This gal here, Julie, little tiny Julie, she comes in, multiple vaccinations, asthma, breathing problems. One of my patients stops them on the way to the medical office and says, you got to go to my chiropractor. They're taking this little 5-year-old pale, sickly kid, and it says, no, she doesn't have a back problem, she's got asthma. I know, bring her to the chiropractor. So she comes in there, we got her off the vaccinations, off the antibiotics, we replaced her normal flora with probiotics. We got her adjusted, which took all the pressure off her upper neck area there, which where the breathing center is. Within a month, she was drug-free. She started to do green vegetable juices. This is what a normal neck looks like, and you can see her neck is absolutely not normal. And now, that was about a year ago, she wants to be a chiropractor. Isn't that cool? I know, I could use the help. Okay, so when you look at this, okay, the keys to optimal health, you have to do the research. It's your responsibility. You know, you were given this body. You've got to know, anything you put into it, it's a spiritual experience. Anything you put into it's going to become your body. Okay, so you've got a responsibility. Okay, God gave you life. We've got to use it. Okay, does that make sense? Good. So you require a healthy nerve supply. Absolutely you do. Absolutely. There's no way to live without it. You need regular exercise. That's to detox your system. You need proper nutrition. This means that man makes it, don't eat it. It's got to be at least 80% healthy, raw, and organic. Sufficient rest. Absolutely. Okay? Prayer and meditation. Absolutely. It just makes sense. Does that make more sense?
Yes, it is.
Okay, it has to. I mean, so primarily, what we do at our office, it's expensive. Okay, we go in, we do an analysis, a drug search, a posture analysis. What we're doing for fall, because we have so many people that come here for the holidays. I mean, people from all around the world. We just had a gal from Ohio. Okay, she came in. She's only here for 3 days. She saw us on the internet. Okay, I just marked her x-rays this afternoon. We're going to be able to help her. Okay, she's actually going to find out that the solution resides within her. Where does your health reside? It's inside of you. Honest to goodness, disease reversal is inside of you. Okay, and that's what she's going to find out. Lori's in the back. She's got some coupons. You can take them $25. You get x-rays, exam, physical, a posture analysis, consultation, drug search, exam, everything. Does that make sense? Yeah. Okay. I got to think, I mean, for you to take time out of your days, okay, to study how your body works, I'm so appreciative because it honors that life force inside of you.
Amen.
Okay, next week we start on vaccinations. Thank you very much. Yes.
Okay, about the